Well, good morning and welcome for this new conference of the Global South e-Health Observatory in the southern countries. This is the initiative of the Pierre Fabre Foundation, and this is a meeting we have here face-to-face in Toulouse in this company's incubator, and we're speaking here of digital companies devoted to e-health, but also to healthcare services. And I think that this is something which is really in line with the values that we have in the e-health or Global South e-Health Observatory. So I would like to welcome you all. I know that you might be in some other remote campuses in other countries or either here in Toulouse. And we've been working for more than 6 years altogether so as to be able to discuss and exchange good practices. Now, I would like to tell you that last year, well, we had a last edition. We have had many participants, more than 3,000 participants who have been participating online. Now, wherever you are, I would like to welcome you and just send us a small welcome message and just let us know how you feel about this meeting, because we feel very happy to have you here in Toulouse, and we're so happy to get messages from remote countries and from worldwide participants. And I think this is going to be a wealth of good practices and reflections. And so as to open officially the 6th conference of the e-Health Observatory in the Global South e-Health Observatory, Beatrice, unfortunately, who is the executive manager of the Pierre Fabre Foundation. Beatrice, I know you have the COVID, so we're sorry not to have you here, but we have Solenne, Barbe, who is also in charge of the program at the Pierre Fabre Foundation. You have the floor. Well, good morning. And on behalf of the whole team of the Pierre Fabre Foundation and Pierre Rivol's as president, the administrators, and also on behalf of Béatrice Garrett, the executive director, I'm very pleased and honored to launch this 6th conference of the Global South e-Health Observatory. We're very happy to welcome here participants coming from Mali, Burundi, Indonesia, India, Pakistan, and the United States, from very many countries. Thank you for traveling so many miles to be here with us today. The conference is also going to be streamlined on internet, and also thanks to the French Agency for Francophonie. This is going to be a very challenging meeting here in Toulouse. I would also like to say that we want to improve the access to healthcare of the poorest, and this is why we have founded this Pierre Fabre Foundation. And this is also why we have been developing this. And we have 2 other partners, the Foundation for Future and the Initiative Network for Information on e-Health. Thank you for this very positive partnership. Now, since it started being operational, the ODS has always been complying with its mission. That is to say, we want to know and assess all the different digital initiatives for e-health development in many countries. We have more than 165 country projects in 84 countries, and 34 projects have been supported financially and technically. Thanks to the annual conference and thanks to its expertise and the exchanges with the different institutional entities, the different partnerships and stakeholders in southern and northern countries have been able to build together a common and shared vision concerning their participation. And the 6th conference is very special for many reasons. We're here in Toulouse, face-to-face, because the Pierre Fabre Foundation has been starting to there are some repairs in the foundation of Pierre Fabre. But we started also renovating the site of the e-Health Observatory, and you can also go on the webpage if you want to see all the information we have been broadcasting today. We have 5 years of work, and we have to capitalize on that. We have to capitalize on this experience, on these information, and see what we have done, what we still have to do, what are the new avenues to pave in the field of research and international research, but also about all the digital projects. So, for instance, if we have a project locally, how can we roll this out internationally? In the very hyper-dynamic sector, what are the investments that we can make? And this is why we want to be together today to be able to assess what we have done, what we have in our portfolio. And we have 5 specific operational projects in e-health. And just before I give the floor to Mr. Pierre Kempf of the AfD and Professor Khalbous, I would like to welcome you again and hope that this conference will be very fruitful. So we have Pierre Kempf and Khalbous. Well, thank you very much for this opening. And we have been partnering with Pierre Fabre since the very beginning and the French Agency for Development. It's Pierre Kempf, who is Project Team Manager, Health and Social Protection Division. And he is here to represent this agency. Mr. President, Pierre Revol, Mr. Dean, very dear friends, very dear colleagues, it's a pleasure and an honor for me to be here to represent the French Agency for Development, and Agnès Souka, who is in charge of the Health and Social Protection Division, who unfortunately cannot be with us today. So I would also like to say that I feel very proud because we are here to support this observatory. And I'm not familiar with all the background, but I think that since 2016, we have been able, all together as we wish to do, to keep up with this partnership, which I think is very robust and very challenging for us, for the Health and Social Protection Division, and for our agency, and for all the other partners. I would like to thank you all to be here and for participating to this meeting. I would also like to thank all the stakeholders, all the actors representing different projects and different countries. I would like to thank Marine, Jean-Claude, Maxime, Victoria, our team, our organizational team, for supporting us. And I would also like to thank Beatrice. Unfortunately, she is not here with us. I'm sure that she feels very sorry about that. Now, just a few words about the AFD. That is to say, it's a public financing and project agency, French agency. The AFD has 3 members. The French Development Agency has been funding projects. That is to say, for the collectivities and other sectors, and ProParcours in the private sector, and another Expertise France branch, which is supposed to mobilize the different expertise that we have for cooperation and collaboration. So just to give you a few figures, we have been supporting each year several thousand projects for 12 billion euros. And the 12 billion euros, of course, have to be considered in a holistic way because 10 billion euros, which concern what we call loans, which are loans for different projects, and then 2 billion euros, which are subsidies, and which is public support for the development of France and projects in France. Now, in the sector of health and e-health, or digital sector, what we can say is that digitalization offers new, different possibilities, diverse possibilities, and we could just list a few of these aspects. For instance, if we speak of biotechnologies, healthcare, we see here that there's a very strong relationship because the technologies help us to give access to health services to many populations, and we also have treatments with a wide series of treatments, but also this helps us to reduce the distance between patients and the treatment centers, but also other tools for the coordination of healthcare and healthcare services. We should not forget the production of knowledge, because this is very important, because digitalization is something which is now developing thanks to many teams producing more information, more data, and I would say that This is very positive because it's helped us to reinforce the democracy because citizens are today and patients at the very center of the system. This is what we hope to do and to develop in the future. This, of course, means that there is a real revolution when it comes to the relationships between health professionals, patients, and also within the systems themselves. Now, the AFD, the French Development Agency, is involved in 3 different kinds of projects. That's the main project in Tunisia is to support the transformation and the national policy of e-health, but other projects which are numerous, diverse projects where digital is playing a massive role, and this so as to comply with other tasks and goals. And we also have support initiatives which are supported by our institutions, our entities through different networks, and also thanks to the what we call lobbying, but also collective commitment. And therefore, we feel very happy to be a part of this with the observatory. Now, we are in Toulouse, and therefore, I think that we have to mention the extraordinary work of Dominique Pont, who has been the ministry representative for e-health and who is from Toulouse. And he has just been working 3 or 4 years for the major transformation of the e-health environment in France. And he has been at the very heart of what we have done in terms of transformation, in terms of achievements. And I consider that he is a real pillar of our initiatives. I think that we have in the field projects which are now developing, and I think that we should keep in mind that we have to promote, support, develop what we call institutional dynamics or momentums, because the public entities have to be more strongly involved in this transformation process. Having said this, I would like to stress the fact that this digital transformation has to help us to reinforce the sovereignty of countries and states when it comes to managing their own data and information. I think states have to play an important role there. They have to protect the data, confidentiality. This is a major issue which is in the hands of all these governments and states, and therefore this is why sovereignty, I think, is essential. Now, the other aspect I would also like to mention is how can we struggle against inequalities, because the e-health has to help us to do this, and we have to reinforce democracy in the field of health. If not, we will have missed one of our main goals. Now, from a more operational point of view, I think we also have to keep in mind that interoperability is also essential, because everybody has to be able to play its role. We need people in the field of industry, of health, but also in politics, because we have states. All these people, all these stakeholders have to interact at the right moment, at the right place, and I think that this is something which will help us to develop this these dynamic initiatives, this transformation process. We should not forget that, as I've said previously, that there is institutional support and control so as to make sure that there is a real interoperability, that there is a real development taking place, but with control of data and information. I'm sure that this is going to be a very fruitful meeting, and therefore have a nice conference. Well, thank you very much, Pierre Kempf. This is fantastic. A new representative of the Health and Social Protection Division of the Agence Française de Développement, and you have been at the very heart of this observatory. And I think that the Pasquim Panbouquier, the Dean of the French Agency for Francophonie, is here with us, and he's going to say a few words now. Of course, I'm very happy to be here, very honored, because we are here again, Mr. President, Pierre-Yves Revol, dear Beatrice. I hope that you will soon feel much better. And dear colleagues, dear friends. Yes, the French Agency for Francophonie and for Development has been part of this project at the very start, but also a partner of the Foundation, Pierre Fabre Foundation, for very many other very challenging and thrilling projects. Now, being here in Toulouse is always a pleasure, especially for me, because I've been studying in Toulouse, and I feel very happy to come back to this city, which is very pleasant. I would like to say two words concerning the international agency, which was created in 1961 and which is supposed to accompany the development through knowledge, especially through the expertise, the academic expertise throughout the world. And the Agency for Francophonie is the first international academic network, because we have more than 1,000 universities and labs part of our network, and these 1,000 universities represent more than 120 different countries. And as you can see here, we really defend the scientific Francophonie, but also in the French-speaking countries, not only in other countries. And our proximity network is also very important. We have, I'm sorry, Slim Khalbous. I think someone has been speaking without being invited to do so. So let's get back to Slim Khalbous. So we've been working for more than 2 years on the development of what we call the proximity networks, that is to say, networks everywhere in the world. We have 60 countries with digital campuses who are a part of this meeting, but also new development centers so as to develop the possibility of finding jobs, employability for younger students, and therefore we have been extending our network, and this is something very specific in our organization because we have a world network, but we also have proximity services in all fields concerning science in the primary, secondary sectors, but also concerning the very specific academic and scientific expertise. Now, when we speak of e-health, well, we've been working a lot in this field for some years, but we have been ramping up in the last 2 or 3 years because, of course, the COVID pandemic has challenged us, and this is why we have been investing a lot. Now, we have 3 sectors in the French, the Agency for Francophonie, that is to say how we can set up new networks, research, and also we have 2 main networks which have been set up in CIDMEF, which is the first network, which is the oldest academic network in the French-speaking, and the CIFERMEF, which is also the other network we have, which brings together all the representatives and experts of pharmacies in French-speaking countries. And last year, we have a third also network in the Science for Health, that is to say, it's a public network. This is something that was missing, because this means that we'll be able to bring together people who are involved in our policies, national policies, and researchers. And this is why we have 3 major networks which bring together experts coming from very many different countries in the world and who are members of this network. And with a very dense activity concerning the prospective studies, especially in the field of health science, especially also in the field of health technologies. Now, this network building is also being developed thanks to a kind of commission or a committee which brings together the representatives of all these networks. We have 5 sectors. One of them is the health of sector, where we find these 3 networks I have just mentioned. And Michel Serres, that I would like to thank, because he is the president of the CIFERMEF, who is today presiding over this committee for 2 years. And we're going to be talking and working on interactivity and all the connections we have between the members of these networks. And also, we are going to try to develop what we've already done in the technological area, because this is very important for the science of health. So this was the first pillar I wanted to mention. Now, the second pillar pillar. Now, training. Training, I think, is remote training, and we have IFI, which is a specialized institute in Tunisia, which concerns digital engineering, with a relay and all the campuses that we have in the 60 countries I have mentioned previously. So this is what we call the academic centers, which are rather member of this network. So we have different diploma and curricula concerning the science of health and different levels, of course. So you can have either universities member of the IF who will provide our students with the diploma, like in Aix-Marseille, where we have a specific curriculum concerning the quantitative approach of e-health. In Bordeaux, it has another approach concerning epidemiology in the field of cancer and a master of e-learning in the field of health. The University of Lorraine, and we have graduated who have a master in the field of health. In Alexandrie, where we have a master in neurobiology, and all these masters are in French, and this so as to extend the French-speaking knowledge and French-speaking training. And there is also a tender today because for those who want to be registered on these remote training platform, and this for many of our students until the 18th of September. Last year, we had more than 1,000 students. So if you have students who could be interested by this e-learning in the field of e-health and science of health, well, why not? And I would invite you to provide them with this information. So we've been today talking with our friends in Lebanon, so as to have 3 universities in Lebanon with a specific diploma concerning the control of the quality of drugs. So quality control of drugs, and l'AUF and the foundation we have in the Middle East are going to be partnering for this. We also have very many initiatives in the field of training of trainers, and training of trainers is also essential. I'll give you just one example. It's the example of what we've been doing with the Pierre Fabre Foundation. For 5 years now, this project will involve other members. This is a framework convention, and this is taking place in Benin and Togo, so as to improve the quality of training and trainers in the field of health. So this is just to give you an idea. So we have networking, training, and research.
In research, as many other bodies, we organized a number of webinars, cycles of webinars, one of which was very successful on the health of women and also health of newborns. This is a taboo in a number of southern countries for reasons of hygiene, but we also discussed contraception, and those are themes that are not very often covered and that we try to showcase in those webinars, because again, those are unmet needs in a number of countries. We also organized a number of conferences on COVID research, and a book was published on CSR post-COVID crisis. We have 2 experts co-writing that book, and that book, so say the experts, have become a reference on questions pertaining to COVID. Around that theme, we also launched a call for project for young researchers in universities, again, to demonstrate how university researchers can contribute to research. 2.5 million euros during the COVID pandemic. Today, about 100 projects are funded by the French agency. We had more than 2,200 applicants, and this is applied research. So research translating in concrete actions. We had a number of very interesting candidates, a number of mobile phone-based apps. We also had very interesting projects on digital platforms for follow-up of COVID, diagnosis supporting tools, and also a number of projects to help in the hospitals, especially with robots, again, to have immediate solutions to the shortage of staff. Now, before I conclude, I would like to say that health sciences are becoming more and more a topic of more interest in research. A number of universities do have curriculum in this field, and the partnership that we have with ODS is certainly a very nice illustration of all collaborations that we have between political decision makers, universities, and private bodies. Thank you very much. Thank you very much to the Dean of the Universitaire Agency of Francophonie. Thank you very much for this very nice reminder of everything you do, all the efforts that you put in order to help knowledge be disseminated around the planet, because this is one of the most important richness that we share. You were no less than 3,000 participants last year for the last installment, and maybe you follow from home or from your school. And amongst the different campuses connected tonight, the campus of Maidol in Bangkok, Thailand, we are going to go there immediately. Hello, who's speaking today? Is it Dr. Bunjai? What time is it in Bangkok, and what's the weather like in Bangkok?
Good morning. It's good evening. Good afternoon here. This is our student and our faculty in the department. It's nice to be in these e-health observatories, really. And the weather is quite hot today, and we have it's quite okay, but a little bit wet in the last few days ago. And we are waiting to participate in this conference. Thank you.
Merci beaucoup, Dr. Bunjai, d'être des nôtres aujourd'hui. Je trouve qu'il y a toujours un...
Thank you very much for being here. I find it's pretty magical to see so many people following from so very far away. We are going to showcase you. Last question for you, Dr. Bunjai, but we're going to ask questions to you. Who's with you on the campus today? Are those students, healthcare professionals, future medical doctors?
On the right-hand side, my colleagues, and in front is also my colleagues in data science for healthcare and clinical informatics program, master and PhD degree. And we have international. Many of them are the health professional, a doctor, like at the end of the table, Dr. Cholatit, he is the emergency physician now taking the PhD. In our programs, and Maria, the yellow lady over here is from Indonesia. She is the one that got the kind scholarship from the Pierre Fabre Foundation, and she are going to finish her master degree in the near future, just a few months ahead. And we have a student from China, and a lot of many of our students are the health professional and health IT, and they're taking the graduated degree in Mahidol University.
Merci beaucoup.
Thank you so much, Dr. Bunjai. It's great to have students, PhD students, master students, healthcare professionals, and we have such students from everywhere in the world connected to benefit from the knowledge that we're going to share tonight. We also have a number of internet users. We're going to say hello to Roger Baku, he's writing from Togo. Hello, Roger. We also have Maurice from Lomé. Lomé, thanking us for this conference. He says, well, I'm learning a lot of time on the French Agency of Development and the other agencies. Thank you very much. We say hello to Maurice in Lomé. And we also have a sad one who says, what is the situation of, in terms of implementation of e-health in southern countries? And I think this is going to bridge very nicely with what is to follow, because without further ado, we're going to jump into the main topic of this conference, i.e. what is the situation in matters of e-health in the Global South, and how can we capitalize on innovation in e-health.